Okay, let's talk about Osgood-Schlatter syndrome. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Osgood-Schlatters is a problem experienced typically by teenagers, especially early teenagers. Probably more boys than girls, but you can see it in both. This is probably something you've seen maybe in your kids. It's a prominence of what we call the tibial tubercle, this bone right there at the top of the shin bone or top of the tibia where your patella tendon attaches. And it can lead to this big bony prominence sort of right there at the front of your knee below your kneecap. Now you can have that and not actually hurt that much, but in boys maybe 13, 14, 15 years old, maybe girls as well, it can be really uncomfortable as they try to play sports, especially running sports or jumping sports that put a lot of stress on that area. And so it's related to aggravation of the open growth plate. So if you do nothing, that's eventually going to get better as that growth plate closes. But a lot of times we try to do some things to decrease the pain while that's going on. So that may be short-term activity modification. Maybe you cut back on their practices a little bit, or you have them switch activities for a little bit so they still get exercise but have less stress on that area. That can potentially be helpful. Sometimes taping can be helpful. Sometimes those show pat straps, the patella tendon straps that basketball players wear for patella tendonitis, I've had parents tell me that that helped their children. My best, just doing this for so long, the thing that I've seen work the best is having the child do a short course of work with a physical therapist, strengthening all the muscles around the knee and maybe around the hip to take pressure off that area seems to be fairly effective so that they can kind of work through it. Now, even if the pain goes away down the road as they become, later teenage years, adult years, that bony prominence may still be there as they get older, but most of the time they're pain-free. This is something that very, very rarely requires surgery, but it's worth getting checked out just so one, you know that that's the problem and it's not something more serious, and two, can take some steps to help decrease the pain so they can get back to sports and exercise. All right, have your kids dealt with Osgood-Schlatter syndrome, or are you currently dealing with it? And what did your doctor suggest to try to get better? I'd love to hear your experience. So in the comments below this video, share your experience so that we can all learn from what you went through. I can't answer specific medical questions in those comments because I'm not your doctor, but I would love to hear your experience. Now, I would like to give you the #1 next thing to do to help you overcome your knee injury. In the description below this video, there's a link right at the top of the description that takes you to a page on my website where I ask you 3 or 4 questions to help me understand your injury so that I can give you the #1 next thing to know or next thing to do to help you overcome that injury. I think it's really helpful, so click in the description, the very, very top link. Now, if you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, please subscribe to my video channel. I record several of these videos every single week and they'll get delivered directly to you, so click the subscribe button in the upper right corner of the page. I hope this video was helpful. If you or maybe your kids have Osgood-Schlatter syndrome, maybe this can give you some information to help you make the decision that's best for you. I look forward to seeing you right here next time.